participants to today's virtual roundtable on safety and health at work in the face of the COVID-19 pandemic. My name is Claudia Cunyaerts. I'm the director of the ILO Decent Work Team and Office for the Caribbean, based in Trinidad and Tobago, and I will be moderating the discussion today. This is the Caribbean chapter of a broader initiative of the ILO in the Americas, where we want to provide space and for dialogue among governments, workers, employers, and other stakeholders to discuss the socio-economic impact of the pandemic, how it's affecting the world of work, and of course, explore solutions. It's actually the second of our Caribbean COVID-19 virtual roundtables that we will organize on a wide variety of themes, ranging from measures for small and medium enterprises to alternative work arrangements, unemployment protection, many different themes that are of relevance when we talk about COVID-19 in the world of work. And of course, today, since we are celebrating World Day on Safety and Health, it seemed to be absolutely evident that we would spend the day talking about how the COVID pandemic is affecting occupational safety and health and what the role of safety and health really is in that regard. Before I introduce the topic and our distinguished panel, I would like to put forward just very quickly some ground rules for a successful virtual meeting. After the panelists' presentations, we would like to facilitate an interactive exchange. In fact, we are very lucky. We already have 204 attendees, but we have a registration of 475, so I am sure that still many will join us. And we really want to give participants opportunity to ask questions for our speakers. Please note that you can only communicate through the chat section. Your mics have been disabled and it will not be possible to take the floor or to share documents. We need to do this to keep our meeting secure and orderly. The roundtable will be recorded and the presentations will be shared. The panelists, of course, have access to video and audio. You are, however, all kindly requested to mute your microphones when you're not speaking so as to have a better quality for our audience. And also to mention that depending on the amount of questions that we will get, we may have to cluster the questions. So you may not get an exact question, an exact answer to the question you have raised. However, we are committed to respond and invite you to send any remaining questions, persistent questions to the ILO email address. And we will then see what we can do, how we can communicate with our panelists. But in the discussion, we are hopeful that we can cluster the questions such that you will receive the answers to your questions. Let me now introduce the team very quickly. We have wonderful speakers with us. And as I mentioned, today we are celebrating World Day on Safety and Health. During these challenging times, our key message is that we need to protect workers, both now and after the lockdowns are ended. Ensuring adequate safeguards will be essential if we are to avoid either a second wave or a full-fledged pandemic in the Caribbean. How safe we keep our workers will determine how safe we keep our communities. And employers have a very important role to carry out risk assessments, to put in place measures, and we will hear a lot about that today. So I have the great pleasure to introduce a very distinguished panel, and I will actually introduce them in the order in which they will speak. So we have with us Mr. Ariel Pino. He is our specialist, our senior specialist on social protection, occupational safety and health. So he will start us off with a presentation very much with the ILO, on the ILO report and very much the ILO perspective. We will then have Ms. Caroline Sancho as our second speaker, who is the Executive Director, Occupational Safety and Health Authority and Agency for Trinidad and Tobago. That will then be followed by a speaker from Guyana, Mr. Asif Ghafoor, who is Health Safety and Environment Manager in Demerara Distillers Limited, welcome to you. And that will then be completed with two workers' perspectives. So we have invited a speaker from the public sector workers, Miss Yvonne Edwin, from the St. Lucia Trade Union Federation, who will talk about the challenges and responses in the workplace, a public sector perspective, followed by Mr. Godwin Thomas, OSH officer, Occupational Safety and Health Officer, Grenada Technical and Allied Workers Union, who will more speak from a private sector trade union perspective. So wonderful speakers with us. I am going to, we have already requested that, but we're going to really want to hold us to a time limit, to some discipline in the presenters' presentations. We would like to ask that you not speak for more than 10 minutes, especially because we want to really facilitate and enable a good exchange with the participants. And we are sure there's going to be lots of questions, so we want to be able to respond to that. I may remind you, if you are passing your 10 minutes, please forgive me if I do so, but I will just do it so that we can facilitate interaction towards the end of the session. With that, once again, a very warm welcome. I hope you will enjoy our virtual roundtable, and I am handing over to Ariel Pino. Over to you, Ariel.
Thank you, Director. Good afternoon, everyone. So I have the challenge to present the report and some insights of our work in 10 minutes. But I invite you, you have the links there in the presentation, I invite you to visit our websites, and you will find the whole presentation and the reports available there. So let me just go to the next one. Okay, so in the pandemic, we have seen that the health crisis had actually infected, let's say in that way, also the world of work. And we are seeing that there are at least key main impacts there. And these are: one, the increased unemployment and the underemployment. The second one, access to social protection. The third one, affecting specific groups vulnerable. We'll talk about a bit more. And then at the end, negative impact on the working conditions, and more precisely in occupational safety and health. And this is where we will be talking about that. Now, because this is affecting different areas of the world of work, the response also has to be linked to a multi-pronged approach. And not only health measures will solve the problem, we also need to address other measures like stimulating the economy and employment, fiscal policies, monetary policies. We need to support enterprises, jobs, income. So we need the enterprises continue doing business probably as before, as soon as possible, so we can generate jobs and people cannot be in unemployment for a long time. Also, as you know, as the tripartite constitution of the ILO, social dialogue is the basis to finding these type of solutions. And finally, protecting workers in the workplace. And here we have OSH, but also we have other type of working conditions, such as the work arrangements, teleworking, remote working, discrimination, exclusion, health access to all, and also paid leave and sickness benefits. So let me start by just the two slides, a small reminder about the rights and responsibilities according to the ILO standards for employees and for workers. As we know, it is a responsibility of the employer actually to provide a health and safe work environment and do everything which is reasonably practicable to get workplaces, machinery, equipment, processes under control, right? Also, the important fact of take measures in terms of chemicals, physicals and biological substances. And this is a biological risk that we are facing now. Very important in the range of control mechanisms, the protective equipment, PPE. So this has to be provided by the employer, and according to the conventions of the ILO, that should be at no cost to the workers. And finally, it's all about information, giving the right platform for consultations, engaging with the workers, and have specific measures dealing with emergencies. In terms of the workers, there is one a bit controversial aspect in terms of the right of workers that they have to remove themselves from war situations in case that they feel that there is imminent dangers and serious danger to their lives. I haven't seen any of these cases in the Caribbean, and if you have any, so please share with us, because it will be interesting to know more about it, right? The second one is the right to receive adequate information and training on OSH, the right to inquire, to be consulted, all OSH aspects in the workplace, and finally, the duty to cooperate with the employer in the field of OSH. That means that every standard procedures, every PPE that is provided to them, discussion, so they need to engage positively and actually fulfill the requirements to keep health and safety workplaces. Let me now just talk about two areas of intervention in which we see that action should be taken. And one is in the policy side and the other one is in the workplace side. And I think this is basically what we have replicated or tried to replicate now in the panel and the discussion what we have later. In terms of the policy, so it basically relates to the actions that government, Labor Department, OSH, agencies can do and should do. So in terms of the provision of guidance, information to employers and employees, goes beyond just formal guidance, but also everything which is sharing of information, public media. A lot of countries in the Caribbean have issued guidelines for employers. They go through social media and Facebook and mass media information. Also, the preparedness of labor and those departments and agencies to provide advice and support, and also the issue of conciliation and arbitration, because we have seen that some legal gaps are existing in the labor law, especially when we talk about, for example, telework. We don't have much legislation, and few countries took the opportunity to pass legislation, like in Chile, for example, and regulating telework, but also in terms of occupational diseases, also in terms of sickness benefits, sick leave, some confusion there. So the labor departments, labor administration, OSH departments need to be ready to cope with that. They need to also set the framework for effective social dialogue that could lead to the improvement of the working conditions. And something which is very, very topical now is the issue of return to work after the lockdown, right? We hopefully quite soon, the situation allows for reopening some businesses and allowing people to go out, because these restrictions will be slowly, gradually removed. So that's a key area now of work in which we started to work at the ILO, and we will be engaging with most of you in designing this type of guidelines for return to work. In terms of the part of the workplace here, so it's important to focus on the identification of the workers, the occupations, and the sectors that are increased in terms of risk contagion. And here we have, for example, the frontline workers, that they are doing a great job to keep everyone safe, and also those who are working in the essential services. The financial sector. The informal sector is very tricky now, because these people need to work, because otherwise if they don't work, they don't get any income. So they are working in very harsh conditions and very unsafe and unhealthy now. Very important, the tourism sector. A lot of economies in the Caribbean depend on the tourism sector. So is there a way that we can actually do the necessary things with the workers, the employers, and the governments to get some sort of a label that we can call it tourism free of COVID, right? And establishments, they can set a lot of procedures, hotels, tours operators, that actually can give trust to the clients from abroad, and they can come and be safe when they visit these establishments on tourists. Very important, the BPO, the business process outsourcing. We just have seen what happened in Jamaica with a big increase in the numbers coming in part from workers in these call centers, for example. Also the role of the implementing the control and preventive measures, focusing on risk assessment, right? Once we identify what are the risks, so we can actually implement control measures. And this is not just for the workers, but also for the public. We need to think about that. Very good things have been implemented now. We can see when we go to the supermarket, to the bank, distancing in lines, in the car shares, etc. And finally, the dissemination, information, and training. All that is because we need to understand what is the probability that those who are exposed actually to some hazards, they become infected. And then if this probability, once we know about that probability, how severe this can impact on the workers and the public in general. So I want to pay a bit of more attention now on these resuming activities and this sort of guidance or procedures that need to be developed to return to work. And one thing that it's probably worth of exploring is considering a phased approach. So when measures are being lifted, restrictions are being lifted, and this physical distancing is less restricted as now, so probably we need to think of the critical staff in each of the agencies that or the workplaces that can start going back to the office, and then the others can come later. So not everyone at the same time. It should be a revision in terms of the organizational measures that they have in each of the companies, in each of the businesses, and adapt them to the COVID context, right? So if there is a need, for example, not to have people working in common spaces or implement these barriers like plastic barriers for receptionists, what do we do with the drivers and people that actually have more exposed than others that probably work in a closed office. In terms of hygiene and disinfection, so probably should at the very beginning in workplaces that are completely closed, a full disinfection should be done, and there is these pulverizers or that they are electrostatic and with the right chemicals to be used. Understand what type of personal protection is needed in the workplace and provide the workers with that. The consideration of particular groups is very important here. We know that some people are more at risk, so therefore we should be careful in bringing them back to the workplace probably at the first time, but also those who need to stay at home because of for example, the school is not reopened, or there are elderly people, or there are disabled people that they need to care about that. Psychosocial factors is something that it was very important in the crisis. Anxiety, stress, we don't know exactly the amount of work that we have. Will we have a job after all these COVID-19 restrictions are in place, and things like that. And finally, as we said before, the idea of based all these return to work on social dialogue, give a big importance to the joint OSH committees and negotiate within this framework an effective return to work policies. So just to conclude, let me say that repeat again the issue of the mental health and violence that we've seen that is happening, especially those who are not working in the typical workplaces and at home. We have seen a research of cases, violence, domestic violence, and harassment. Also those who are in the front line, working from home, or those who have lost their jobs, they are in severe needs, and the stress is really not helping now. The second one is that we need to protect our workers, because we know that the health and safety of our communities, it depends on how these people are protected. The same thing exactly for the businesses. Now we realize more than ever that OSH is a fundamental right, as it was mentioned in the Declaration of 2020 of the 2019 in the Future of Work last year, and should be seen as an essential investment to protect workers. Now you will see that employees will need to incur in extra or in additional cost, because especially those who are already in businesses, so they need to adapt, right? So an extra investment was needed. And when returning to work starts, so there will be additional costs, but this should be not seen as a cost, but as an investment in the most important asset that companies have, which is the workforce. The frontline workers definitely be the other heroes of this COVID-19. And the health and safety of these people need to be kept at all price. So far, we see that the spread community in the Caribbean is not so important, which means that beyond of the societal response to that, workplaces are doing the right thing. The requirements considering for the return to workplaces we just talked about is something that is more urgent now. So we all need to start thinking of how we address this issue, because it will add new challenges in the workplace, but also which is everything around commuting, transportation, and things like that. So I cannot conclude but just expressing the ILO solidarity to frontline workers, essential workers that are now the heroes in this pandemic, and also our condolences to those who have been affected, infected, and lost the lives of relatives of some people that they know. Thank you, Director.
Thank you very much, Ariel. You were 1 minute over, but I think you covered so much ground that it was absolutely acceptable. And so we will kindly ask the other speakers to also remain within their times. I would like to hand the floor to Ms. Caroline Sancho, who is going to talk to us a little more about the specific experience in Trinidad and Tobago. And if you want to remind us when we need to change slides, because I think we are managing the slides for you. So over to you, Caroline.
Hi, good afternoon, everyone. Well, I'm here to talk about our agency in Trinidad and with regards to how we responded to our experience of COVID-19. So I have a background, OSHA's approach, the challenges, and the way forward. Right, so in January 2020, the changes started to impose travel restrictions in response to COVID-19. Then in March, we got our first reported case of COVID-19. Then on March 6th of March 2020, government schools closed. And then on the 29th of March, government imposed restrictions on movement of citizens. And then again, on the 16th of March 2020, we then initiated limited control measures within the agency. And on the 29th of March, we then responded to the government's directives, and we expanded our control measures to a full remote work strategy, working from home, away from the office. So we looked at two things in terms of the emergency protocols. We looked at a crisis communication plan for persons within the agency, and also how we would communicate with our external people who would need to access us. We also looked at a business continuity plan in terms of how we would then operate now that we were no longer in an office setting, but we were working from home. So we had to look at how that would be implemented. So the key objectives internally were to keep staff informed of all the developments regarding the pandemic and also the operations of the agency. That had to change a little bit because some of us were accustomed to working remotely sometimes because we have inspectors who work out in the field, and therefore communication with them would not change that much because they had access to tools. But we also had staff who didn't work in the community and didn't work in field, and therefore we had to think about how we would then keep communicating with them to maintain the operations. Also, we had to look at how we would then speak to our external stakeholders regarding developments and any advice that they would need for their employers and employees. And we need to ensure the business continuity of the core functions, which is the inspectorate of the agency during the management of the COVID-19 crisis. So that was our approach initially. So in terms of communicating with staff, we prioritize staff because I mean they are the ones who would carry out all our directives. So we needed to make sure that we prioritize them. So we reiterated our policies and procedures, provided information on the virus, published some information on the virus on our website and on our Facebook page. And also we had meetings with them so that we could discuss our new operational arrangements. We also had to relook at making sure that we had up-to-date personal and emergency contact information and also alternative email addresses apart from the work email addresses in case our system went down. So we had to look at backup systems as well. In terms of our external stakeholders, or they were prioritized and essential contact information was also updated. And we put that out on our webpage as well so that they can know how to contact us. We provided new information in terms of more phone numbers that, in terms of who they could contact apart from the usual contacts we would have, so that they would then have more access to the agency. We looked at the communication needs of the stakeholders, what information they would need, what employers would need, what we would need to put in the media. We developed that and we shared that as much as possible. And then we had some development of guidance using information from Ministry of Health. Ministry of Health in Trinidad were very proactive in their approach to looking at COVID-19. And we wanted to make sure that everybody use information from a source that was credible. So we streamlined our information to make sure that it was in line with Ministry of Health so that we could then give information to the public that was not different from what our ministry was saying. And we also developed a series of blogs for our website that looked at employers' responsibilities, employees' responsibilities, even refusal to work, because that was an issue that came up where people were saying that if they were exposed to COVID-19, can they refuse? So we were also giving guidance with regards to how that to be managed so that we could have it more controlled. So in terms of the continuity of core functions, we identified what the core functions would be. In terms of administration, we looked at HR, finance was something that we had to look at in terms of how do we work remotely to still provide HR support, how do we work remotely to still provide finance support, how do we do payroll duties to make sure people got paid on time. So we had to work with the ministry with regards to that to determine who would be the key people that would have the responsibilities and therefore be allowed to access the office even when the office was closed. In terms of enforcement activities, we looked at the activities that we had outstanding, any accidents, complaints that we had outstanding that were not completed. Inspectors were asked to finish those at home or to look at those at home, so that we could at least keep that side of it going. And if we needed to put anything within the court system, we would then have that done within the period of time it was supposed to, because we have a 2-year statute barring for all our cases. So we had to look at those cases that were coming close to being statute barred and prioritize them so that we can keep our enforcement going, and also public education. In terms of what I mentioned before, our website and information that we had put out on our Facebook page. So we made sure that people were aware of how they could access us and what was our level of operation at this point in time. We did a needs analysis to determine what resources we needed, and then we provided the resources as much as we could. So we had to, for instance, give our hotline operator an additional phone, even the receptionist another phone in case people called in, they would still get through to somebody at OSHA who then pass a message to the relevant person. We had to regulate our operations in terms of hours of operations, in terms of, well, not being at the office, but we are still 24-hour accessible via these phone contacts. So people were aware that we could still receive complaints and receive information, and then we would prioritize how we deal with it. If there was a fatality or a critical incident, we would then have to determine how we would then go about dealing with it and also investigating those matters. So the challenge, we still had challenges because we were trying to operate in a new way. As I mentioned before, internal and external communication. We had systems in place before where we had to build additional systems to make sure that all internal people could communicate with someone. External communication as well, with our stakeholders, we had to make sure that as much as possible, we put as much information out there so they could know how to access us. But it continued to be a challenge in terms of making sure that we had full coverage. enforcement activities as well. Accidents don't stop happening, and because of the fact that we still had people who were seen as essential services operating, then safety and health risk would still exist. So trying to have enforcement activities in a situation where you have a lockdown was also challenging, but we had put a system in place where we would continue to monitor what was going on and determine how we would then deal with issues that come up that were seen as urgent, seen as critical. We would then make a decision as to how we would deal with it as they come up. So we had systems in place to keep monitoring that. Network connectivity as well was a bit of a challenge, but we worked with our IT department, who continues to work very assiduously on this. And as much as possible, we have as much network connectivity as possible. Many of the inspectors and workers within OSHA do have Wi-Fi access. They do have phone access. So we use that as much as possible now, but it continues to be a little challenge because we now have to spread it wider, and also access to physical resources, because most of our resources are based in the office. We're not completely paperless yet, so we still have resources and files that are in the office, and that is another thing that we continue to try to access and find ways to do. So in terms of the way forward, we're looking at 3 phases of going forward. Managing through the pandemic, which is what we're doing now, which I explained with the last few slides. But we also have to look in terms of recovery once businesses and offices start opening back. How do we then proceed with continuing to make sure that we prevent COVID from spreading, continuing to make sure that employers and employees are aware of their duties and responsibilities, and also even post-pandemic, how far do we go, in terms of teaching people and making sure that people maintain the same sort of hygiene, regime that they had before, so we could make sure that we don't have people reinfected, because we're not sure yet as to how this virus, mutates or what it does. So in terms of risk management and so on, this is what we're looking at post-pandemic, to make sure that we keep workers safe. So we looking at public education through training, provision of guidance, and also our enforcement activities as well, to make sure that people keep within the guidelines and rules and regulations that are put down, to make sure that we keep COVID-19 at bay, and placing emphasis on health and hygiene in this regard. There are a few services that have been deemed as essential services, which are people within the protective services, the health sector. There are some services that are continuing in the energy sector, for example. Retail services are still continuing, education sector. Those people are still out there working. And so we decided to look at those sectors as a priority and then look at the others. We put education there because we expect schools to open back in a few months' time. And that is a big sector, which will have quite a few issues. And I think if we manage to educate them before all the schools open back, we would have a good chance at helping with prevention in that situation. We had discussions with the energy sector recently, looking at their provisions for offshore workers, and what changes and modifications they would have made for people who have to work offshore and be offshore for weeks at a time, transporting them offshore, in terms of the transport that they use, and social distancing within the helicopters, and
Ms. Sanchez, so sorry to interrupt, but may I ask if you can maybe just start rounding up and keep anything else for the discussion that we will have later?
Right. So this slide, finish with this slide now, and that's it. Thank you.
Okay. If I had known, I should not have interrupted you. But thank you very much. Thank you very much. It was very good to hear how how the government is really sort of elaborating its role and what processes are involved. So I'm sure that there will be interesting questions once we come to interactive part of the discussion. I will now hand the floor to Mr. Asif Ghafoor. We're very happy to have you. You are voice from the private sector. You can tell us a little bit more about how you are handling with the situation. And as we've been hearing, there's a lot of responsibility on employers. So it would be good to hear how you are coping with that and what things you have been putting in place. So over to you, Mr. Asif. I am not sure if you are speaking. If you are, we cannot hear you. So maybe you are. Okay, I think we can hear you now.
You can hear me now.
We can hear you now. Very good. Thank you.
You're welcome. Okay, I will attempt in the next 10 minutes to give you guys an overview of the challenges here at DDL as it relates to COVID-19 and what we are doing to combat this pandemic. In my presentation, I'll attempt to outline you the challenges faced, as I just said, our response in stemming the COVID-19 pandemic, what we are doing cooperatively, and summarize to you at the end of the presentation what I would have presented. Due to the outbreak of the highly contagious coronavirus, as we refer to it as COVID-19, DDL, or Demar Distillers Limited, its employees and its customers are all at risk of contracting this deadly virus. Therefore, as a company, we have made provision in order to reduce the spread of the virus and also fulfill our corporate responsibility in the face of a potential viral outbreak here at DDL. The measures that we have implemented not only take into consideration our premises and our employees, but we also take our customers into consideration and the general public as well. The biggest challenge that we have is because this virus is new, it's new to the world, it's how we as an employer try to mitigate this from, spreading in our business here, and not just that, our customer and the general public as well. In general, these challenges include in placing and maintaining distance between persons, enhanced sanitation and deep cleaning methods for our facilities. The key also is how we sensitize our employees and bring about awareness. Very important in all of this, and one of the biggest challenges we have is how we manage, or how we will manage employees who begin to show symptoms. And the continued challenge is ensuring that how we prevent sick or infected persons from entering our business on a day-to-day operations. For starters, in terms of stemming this transmission and safeguarding the health and welfare in the workplace, we have provided additional hand wash stations at all our facilities. So these have been strategically placed at all the entrance of our locations across the group. All individuals entering our premises are mandated to wash their hands before entering. We have also posted strategically hand wash signs with instruction on proper methodologies on how to wash hands. And for convenience purposes, we have also mounted soap dispensers, whereby employees can have access and visitors can have access to detergents for the washing purpose. We have also engaged in screening and restrictions of persons who enter our premises. So temperature checks have been implemented at all our facilities across all the operations. Access is actually denied to visitors except those conducting urgent business and making deliveries to our operations. As I mentioned just now, all persons They're required to wash their hands thoroughly at the strategic provided hand wash stations before entry. And we also do some screening in the form of a security checklist that has been established for all visitors, whereby this is to make sure that they are actually screened and they fill out a form, and this form is monitored daily by HR department. As it relates to reducing of physical work interactions, we have replaced all our face-to-face meetings with virtual meetings. Persons who are capable of working from home have been made to do so. That is after we have put in all the infrastructure in terms of IT in place. We have also engaged staff, those who are desirous of going on leave. They've been asked to take their leave during this pandemic. All face-to-face conversations have been replaced as much as possible with phone calls during this period. In terms of employee sensitization and awareness, we have placed signs and posters strategically around all our facilities, providing information to employees on the virus and its symptoms and measures to keep safe. We have actually sent out advisories to all our employees as it relates to good personal hygiene and what to do in this particular pandemic. For example, the washing of hands properly with appropriate cleaning agents. When they cough and sneeze, what to do. Very important, avoidance of touching face, eyes, nose, and mouth. Critical in this was ensure that we greet everyone without handshakes now. And we have also been sensitizing them on healthy diets as well. The importance of getting enough vitamin C to boost the immune system. As it relates to sanitization and cleaning, we are predominantly a manufacturing operation, this food manufacturing that is, and cleaning and sanitation is fundamental in the food business, as everybody will know. But we have actually had to enhance our cleaning regime where this is concerned. So the frequency of deep cleanings for offices, plant facilities, including machinery and equipment, has been increased. The regular disinfecting of frequently touched surfaces is something that we are doing on an hourly basis here at DDL. We have also issued, which I will talk a bit about just now as well, to all our employees, company-produced sanitizer for their own personal use from time to time. As it relates to PPE, the protection of the mouth and nose is very critical at this time. So we have actually provided masks to all our employees on the job. We have actually written protocols that have been issued to employees for the wearing of these masks and the cleaning of reusable masks. And we continue to try to make sure that we have enough reusable masks in stock to carry us through this pandemic. A key area for us also is management of, persons or employees who show or report symptoms. We have established protocols here at DDL in terms of how we deal with that. Each employee is monitored and followed up individually, and we have appropriate steps being taken after discussion and after a period of time has elapsed. All employees who show symptoms are advised to isolate themselves, contact our local Ministry of Public Health on their hotline numbers, and obviously not report to work. In terms of transportation, the government has actually implemented a curfew of 6 p.m. in an attempt to keep persons off the road during the evening hours. So persons who have been working beyond 6 p.m. here at DDL, we have actually been providing transportation for them so that they can safely reach home as well. From our distribution side of the business, at our cash and carry outlets, and this is where the customers are introduced. All customers are made to wash hands at the end at our hand wash stations. that we have strategically placed at the entrances of all these outlets. We have restrictions placed on the number of customers allowed in our stores at once. We have made it mandatory that they must wear their masks or else they will not be allowed in the store. We have distance markers strategically placed in the store to ensure that customers stay 6 feet apart from each other whilst conducting their business. Apart from our factories and our other areas, we also have enhanced cleaning procedure at these outlets as well. And we also ensure that we regularly sanitize our trolleys and shopping baskets that the customer utilize when they come to shop with us. I will quickly go through our corporate efforts in terms of what is it that we have been doing.
So
Obviously, as I mentioned,
just wanted to mention very quickly, Mr. Gafour, so if you can try to round it up in the next minute, that would be great. Thank you.
Okay, sure, I can do that.
Okay, wonderful, thank you.
In terms of our establishment, I did spoke about, we have established a lot of protocols here at DDL to deal with COVID-19. We have actually, our operations commenced during the COVID-19 pandemic to produce a new alcohol-based sanitizing agent for commercial purposes. And these have been available in 3 sizes on the market. And from a donation perspective, to show our corporate social responsibility, we have actually donated in excess of 15,000 liters of our alcohol-based sanitizer to key institutions, orphanages, homes, health clinics, and the Ministry of Public Health as well. I will just attempt quickly to conclude what I just said. In essence, what we have done, we have made hand wash resources and sanitizers more accessible. We have sensitized our employees in terms of COVID-19, and we have encouraged proper hand and respiratory hygiene amongst them. We have enhanced the frequency of deep cleaning. We have created documented protocols during this time. We have encouraged social distancing and reduced face-to-face interactions. We've implemented temperature screenings. We have provided face masks, bottles of alcohol sanitizers to all our employees, provided transportation, as I just said. And key to all of this also, we have developed a new sanitizing product for commercial use during this time. And we have donated a sizable amount to priority institutions. All in all, we continue to monitor the situation closely and remain aware of updates posted by the relevant authorities, such as our local Ministry of Public Health and WHO. And we continue to implement appropriate measures in an attempt to effectively mitigate the transmission of COVID-19 in our workplace.
Thank you very much, Mr. Gafour. It was very useful to hear the private sector as a very concrete example on how you were dealing with the situation. And I would now like to, we have 2 very important speakers still remaining, workers' perspectives who we would like to hear. And we will start with Ms. Yvonne Edwin, who will be talking more from the public sector perspective. So over to you, Yvonne.
Good afternoon, all. So my presentation will focus on occupational safety and health challenges and the responses in the workplace, particularly within the public service. COVID-19 has presented a set of unprecedented challenges in all spheres, and likewise the public service. It has painted a very unique but a vivid picture of how basic occupational safety and health safeguards have been compromised to an extent within the public service. The pandemic, it has brought into focus the lack of adequate policy guidelines to mandate safer and hygienic practices, adherence to the OSH protocols, proper administering of personal protective equipment, and actually the implementation of more proactive mechanisms to better function and operate within the public service. For the overall challenges that we have seen throughout the public service and since the pandemic started is coping with uncertainty, the psychological effect, and the future prospects. And I will go into detail to explain what that means. Coping with uncertainty, what we saw happening across the ministries or across the various government departments was inconsistencies. So you can move to the next slide. A number of inconsistencies. So one department would implement a measure, another would apply another type of measure. And so there was no clear policy position. And so there was a lot of inconsistencies being applied across various departments. There was insufficient information from official sources, and that left workers uncertain as to how to maybe apply a basic thing as such as sick leave. So one department would have done one thing and elsewhere would have applied something different. There were delays in installing protective screens. So for reception areas, there may have been no budgetary allocations, and so there were delays in putting up those screens or protective barriers for workers to continue to function. We've heard quite a bit about unavailability and in some instances, inadequate supplies in terms of personal protective equipment and other supplies. These were not readily available. And in cases where they were available, the replenishing of that stock was not, it was delayed, again, because of the unpreparedness. There was slow responses by management to organize business continuity plans. So again, being unprepared, these plans were not in place. Every department should have a disaster plan, but in terms of a business continuity plan, in light of something like this happening, that was not in place. And so persons were not sure of how to operate or cope. Adjusting and working remotely through the use of technology. So again, a lot of new adjustments needed to be made, working from home. Persons were not sure if to go into the office, though they may feel sick and not have symptoms, they again were not sure. So these were some of the coping and the uncertainty as to how to deal with what was happening. The psychological effect, of course, increased stress, ability to remain focused on the job. So even when a department would have had a schedule set, persons being in there, having to leave the office to go home or to commute from home to the office, they were not focused on the job. And that created a lot of panic among workers in some instances. There was concerns for leaving children at home or the elderly and not having persons to care for those persons. Because yes, you have to go into work, but leaving the children and elderly, your priority would have been your family and not going into work. So again, another concern in terms of that psychological effect it would have had on public officers. And the final one is the future prospects. So the fear of losing your job, salaries, and all of these things were future prospects that you could not plan ahead for, or even planning your work. So the next slide would show how these four components, how that created fear, and again, a lot of uncertainty and your inability to plan ahead, because again, you're not sure of the duration of the crisis. Fear of changing the nature of work. Again, you're working from home now. You had to depend a lot on technology. So your everyday approach had to change, and there was need for some adjustments. There was one department who may have had a plan in place, the Inland Revenue Department, and the next slide would show that. And even when COVID-19, amidst the COVID-19 threat, there was something already in place by this department, in more or less something in place, and they could have applied it. And the next slide would show you how some of those measures that they put in place were the very measures that most public offices or the public sector had to implement. So they were able to have these responses in light of COVID-19, but they already had a plan, a very similar before that. And so it would have required them to increase the frequency of cleaning and disinfecting, of course, with the emphasis being in the customer service areas where you would have the contact with persons coming in to transact business, the placement of hand sanitizers and dispensers in strategic locations, your entrance, your bathroom, again, a lot of places that persons would frequent, an issuing of hand sanitizers and aerosol sprays to the different, these were already in place by that department, and we saw a lot of that being applied, even when other departments, the public sector, the private sector, encountered difficulty or trying to mitigate against COVID-19. The development of business continuity plans to identify critical staff, that was something that every department across the public service had to implement, understanding who was essential, who was critical, and what staff or who you had to streamline to be that staff complement that could have continued the service or continued operating. The provisions of periodic updates to staff. So when new information became available, that had to be filtered through a very strong communication channel. So again, looking at all of these things and how we communicate in the workplace, but communicating out of the workplace in light of COVID-19 or any pandemic was something that had to be looked at as well. Developing protocols and guidelines. So what you saw, a lot of new protocols, new guidelines, even there was nothing in place before, these had to be more or less developed, implemented, and tested at the same time. The next slide shows, and most ministries again would have applied this because this was coming from the Ministry of Health in terms of what to do and hygienic practices that we should have been applying, you know, in our everyday methods of going to work or operating. These were things that should have already been in place. But again, COVID-19 brought this into focus. So washing hands frequently, covering our cough, touching areas and such as your eyes, your nose, your mouth, and we know for COVID, that may have been the particular areas that we had to be mindful of. Practicing social distancing, again, a new term coming to light, and it's no new term, this has been there, but hearing a lot more about it. And using alcohol and hand rubs, again, to sanitize and to ensure that you're keeping safe. Staff was strongly encouraged to limit visits to public spaces. We saw a lot of that happening, and no different within the public service. Again, what we relied on or had to rely on is a lot of official information sources, so from PAHO and WHO. This is where most of our information came through, channeled through our Ministry of Health. Once the government had declared a lockdown and closures and the need for non-essential services to remain at home, and trying, when we had a partial shutdown of the country and just ensuring that the public sector continued to operate in a way, there were what the public service approved was an alternative work arrangement policy. And what you saw happening was there was a staff rotation, so a very scaled down staff complement coming in between the hours of 8 and 12:30 across various departments. A lot of staff working from the office had to be provided with masks and applying the social distancing protocols. And even the working from home arrangements, you had to take into consideration persons who would have to commute, persons who may have had underlying conditions, and persons who were not needed in the office. You had to try to ensure that some rotation or some schedule incorporated them. Again, looking at the whole continuing of business. The last couple slides basically summarizes the challenges and responses in a nutshell. So from all what I have said from the previous slides, the challenges mainly was communication and just changing how information was communicated, not from the office, but through a very strong communication channel, through the internet, through phones, and ensuring that we implemented the social distancing regime that came into play. The inconsistencies across departments, so how schedules were applied or how new policies and guidelines were applied was definitely a challenge because, again, as I explained, each department almost adopted their own policy or their own guideline, and it should have incorporated the entire public service. The last two, I spent some time already highlighting those, but these were the four main challenges. The responses basically is that we are very reactive. So there are a lot of reactive mechanisms, new policies being developed. We had to revert to traditional practices, but what we did see was a renewed spirit of collaboration and teamwork, and persons more or less working together to not just fight it, but to ensure that the public service continued to function. I think one policy that came out was the alternative work policy, which was adopted by the public service, and definitely something that we have to look at in moving forward. I thank you.
Thank you very much, Ms. Edwin. It was very good to hear like how the public sector has responded and clearly how we learn from from these challenged moments and develop new things such as the policy you were referring to. I'm sure that there will be some further questions going forward, but thank you for that. We now move forward to our last speaker, Mr. Godwin Thomas. The floor is yours, and if I may ask you if you can also stay within the 10 minutes so that we have some time left for exchanges. Over to you.
Okay, thank you, and I'm delighted to be part of this round. And by opening comment to say that I'm happy to be part of this forum today, speaking on occupational health and safety. On the day for occupational health and safety, over the years, I have not had the opportunity to address this matter as occupational health and safety officer of my organization, due to the fact now would have been peak time for the organization of our national media activity. And as organizing secretary of my organization, I would have been focusing on our media activity. Challenges of workers in the private sector during COVID-19 is the topic I'm covering. And the first issue I would want to raise here is the fact of the psychosocial issues. And here I'm not talking about mentally ill persons, but I'm talking about the issues as it relates to our workers and the uphill task we'll have of keeping our workers from gathering and social distance. I think that's an important factor for us, because as we know that COVID-19, these two things play a leading role in persons contracting the virus. And as such, this is a matter that we are paying attention to, and we are monitoring our workplace to make sure that the workplaces that are open at present are keeping the distance at this time, and that there's no congregating during the workplace before work and during lunch periods also. So we are monitoring that, and we're trying to keep that situation under control by the union, and in that we will be able to keep the social distance and the gathering of workers away from that situation. And that situation of social distances and so is something for now, and it is something that we'll have to manage in going forward in managing COVID-19. The second point that I would want to make here, the second point is to do with personal protective equipment. And I want to say that with the announcement of that pandemic and the possibility that it will reach our shores, we did not make the necessary provisions for personal protective equipment for the nation. And that has haunted us during COVID-19. There was no stock of personal equipment to be distributed among our workforce, and that was a serious issue that faces our union. However, as a union, we are able to meet and come up with 14 points that I think that would have guided us through our activities during COVID-19. And that was distributed to our workers as a way of guiding them from and protecting themselves from the COVID-19. We had frequent meetings with the two areas most important to us as it relates to persons exposed and COVID-19 getting to our country, our seaport and our airport. We have met with the Occupational Health and Safety Department of the Airport Authority on a daily basis during the first days of COVID to ensure that all systems were in place to protect our workers and the general public as well at the airport. We also met with the Occupational Health and Safety Committee at the Green Port Authority. And that organization met once weekly and came up with several points they came with a 14-point document for protection of general protection of its workers and there were some sub points made individually for different departments. For example, for the cleaners, for the pilots, and different for the port. So every department has had something to guide them in protecting themselves at that entity. Also, too, there were several these meetings and them at the Port Authority. They was addressed. We had generalized meetings, and we also had meetings with just the Occupational and Safety Committee. These meetings were attended by the chief medical officers and other high-ranking personnel of the Ministry of Health, addressed both workers and the community, and gave general guidance to the committee and how it's going to go forward in protecting themselves. The union sent out documents to all of the frontline workplaces, and our frontline workplaces in this case would have been our banks and all our financial institutions, as I mentioned before, airport and seaport. That document that we sent them gave them general guidance as how they should operate in this time of COVID, and also we seek to meet with these management of these enterprises, and these meetings were attended both by the union, management of the company, and in most cases, the chief medical officers accompanied us to this meeting to give some general guidance as to what we do. Those meetings also, when we attend those meetings, Ministry of Health and Union, it was used as an opportunity to do inspection of the workplace to ensure that all PPE and that the COVID-19 protocol is being adhered to. In one such workplace, we had to change around the seating accommodation at that workplace due to the social distancing. These visits and meetings with management was very successful. In some cases, we were able to come up with additional points for safety of the workers and the general public. The third point I want to raise as it relates to the challenges of COVID-19, as it relates to our situation, I guess that would be the situation, as I heard somebody mention before. It would have been one of the situations that would have plagued not just Grenada, but the rest of the Caribbean and other parts of the world. And that would be a vacation being taken, have been given to workers as trade-off at this time of COVID-19. It's something that our union does not support at all, that workers having to take a vacation at this time. But workers would have to take those vacations in order to sustain themselves, in order to have income. It's a matter that we'll address after the situation has come back to some form of normalcy. Exposure of our workers is one of the issues, as the country as a whole were not prepared for COVID-19, and some of the businesses that we represent didn't have all systems in place to protect themselves from COVID-19. Examples, we represent workers in the banking institutions, and certainly the contact between the customer and the tellers at the bank, there was no protection. Since then, we are able to get the banks and other institutions, cases, but more so in institutions, to have some form of protection between themselves and the customer. In fact, we have got plexiglass, and so to be placed, so provide some kind of separation between the teller and the customers. Other point that which I would say, case number 15. That case number 15, because we now have 18 cases of persons contracted with the COVID-19. And case number 15 was a person from one of the workplaces that we represent. And that case number 15 were able to, two other workers at that workplaces were contracted with COVID-19 as well. The union's position then was that the workers should not be in the workplace. And that was an uphill task between ourselves and the management of that particular company. However, the union were able to get the worker out of that company to stay home and did not report to work. And subsequent to that, the union were able to address by way of correspondence to the government, requesting that the building be locked down. And this was done. And the test that was done followed, where all 60-something workers at that workplace were tested for COVID, and that workplace now has 3 persons who contracted COVID. The rest of workers were tested negative. This followed with a second workplace represented by us, who in the rapid test, 2 workers came down positive. And yet again, we have had to ask that workplace to be shut down, and followed by same protocol correspondence that the union would have sent out to the government of Grenada requesting that second workplace also be closed, and they are closed as we speak now. That same workplace has been closed, and the Ministry of Health is carrying out the task.
Mr. Thomas, I'm so sorry to interrupt, but are you nearing the end of your presentation?
Yeah, I'm near the end.
Oh,
I'm near the end. I'm watching the time.
it's
Yeah,
actually it's 10 past 3, so I would like to still make sure we have some time to go back to the panels, to the panel members with some questions. So if maybe you can round up in the next 30 seconds.
Certainly. Finally, I want to make 2 points. One, the opening, the closure of school and the issues surrounding that in terms of security of our students. That's a matter of that's a challenge for us and a concern for us, which we'll have to address. And finally, when we are coming back to some form of normalcy, our new normal will have to change, in that we may have to look at the question of workers coming to work much earlier and leaving later in order to have a shift system so that everybody would not be on the job at the same time, because most of our workplaces are not designed so that you have that kind of social distances, and that might be one of the recommendations. And that we also, as a union and labor organization, it's something that we have to take into consideration whether or not we'll be able to monitor the different workplaces when they come back on stream and economies open up, to make sure that the social protocols and the other protocols of COVID-19 is being adhered to. Thank you.
Thank you very much, and thank you to all the panelists, but also very much to the entire audience. We have a large audience, and we have been receiving lots of questions, and you know, I think we can now spend the next 20 minutes before we close with a few questions that I will bring back to you. So one of the questions was to Ms. Sancho, how to handle workplace inspections if inspectors can't attend. I think you're not muted. Yes, now you should be unmuted. Please go ahead.
We normally receive complaints. Anybody with any concerns about their workplace will send a complaint over. We have a system in place where we have prioritized the level of the complaint in terms of the level of the risk based on what is they're complaining about. So once they send in what their concerns are, we'll look at it and we'll make contact with them. And depending on whether the severity is high, medium, or low, we would then determine how we would carry out an investigation there. I mean, a lot of our initial contact comes via phone, so we can get more information. And sometimes you'd find that you could actually resolve the matter when you provide information over the phone. So it's a sort of phased approach that we take, but we do assess all of them, and we find ways to investigate them depending on severity.
Thank you. I have a question for Mr. Gafour. Do you expect, and in fact this relates also to our last speaker who was talking about, whether these protocols will continue to remain in place. So the question was, do you expect these sanitation protocols to be maintained after COVID-19, the COVID-19 pandemic is under control? Or do you expect procedures to return to pre-COVID protocols? Any controls implemented with regard to airflow management?
We expect the procedures to be maintained. I'm sorry, I was getting a call coming through my system.
That's all right, go ahead.
Yes, Claudia, we have made a determination that we will not change any protocol. as it relates to our cleaning and sanitation regime. So we will maintain whatever we have implemented thus far. As it relates to airflow management, that is something even before the advent of COVID-19 that we have implemented at our facilities, because ventilation is a key aspect of our health and safety program here at DDL. So airflow and positive airflow and proper ventilation for employees is captured under our health and safety mandate.
Sorry, thank you very much. Another question that was more directed towards Mrs. Edwin and Mr. Thomas is, should there be guidelines with respect to the number of workers by square footage to ensure effective social distancing in the workplace when the lockdown is lifted? So what are the trade unions' perspectives on that? Maybe we start with Ms. Edwin?
Thank you for that question. I definitely think that it is something that will have to be considered, even in reopening or lifting the shutdown and the scale downs. They would have to have a phased approach, like some of the speakers have indicated, and also to ensure that the social distancing and these sorts of, this is included, sorry, in the guidelines and policies. And we do not just jump right back into normal. That would definitely not be the position, but to ensure workers are protected and it's phased.
Thank you. Thank you. And Mr. Thomas?
Yes. Hello? Are you hearing me?
Yes, we do. Please go ahead.
Okay. I'm saying that, and I did make the point out that the new normal would be different when the economy is open up, and that we may have to, because of how our factories and our different workplaces are designed, it would not give us an opportunity to have our social distancing unless they will have to rent or expand on these buildings. So the recommendation from where I sit right now would be that the working hours change so that you have a two-shift system or so, where some workers may come out to work at 6 and end at 2, and then you have one come out from 2 and goes into the probably 7 at night, in order to maintain our social distancing in the workplace.
Thank you very much. We also had a question related to the phased approach and how that would look like. So I wanted to see if my colleague Ariel Pino, if maybe you can elaborate a little bit on that.
Well, thank you for the question. What I was trying to say is that at the very beginning, probably the critical staff are the only ones that should be the ones coming to the workplace, and this is to make sure that all conditions are met for the rest of the colleagues to come. Of course, that will depend on the size of the workplace, on the number of employees, but at least they will be. The thing is to avoid that everyone come at the same time in the office. So. For example, this question about social, physical distancing, sorry, we prefer to call it physical and not social. Physical distancing, so I mean, if you cannot ensure this 2 meters or the 3 feet, so probably you shouldn't allow everyone to come at the same time. So probably you need to arrange for a rotation mechanism, for a shift mechanism that not everyone comes every day on the week, but some people can come 1 day of the week, 2 days of the week, the others can come the other parts of the week. This is if you allow me, just there was another question about also the related to the implications if we continue working on telework, and I think basically the issue is how we can manage the, first of all, work-life balance. And this is also needs to be related to the phased approach. I mean, if you cannot oblige everyone to come back to the office as everything is going in the normal way, but the normal way is not the rule. Meaning, for example, schools or geriatrics or foster care or whatever other for children facilities are available. So this is part of the phased approach too. And the other thing is for telework is basically ergonomics is very important. At home, so how you set up your ergonomics at home And finally, how the everything which is the protection of working conditions is legislated in the country. So what happens with a work accident if it happens at home? So it could be a work accident or not. So all these type of working conditions issues needs to be legislated, and also the Labor Department needs to be upgraded to be able to deal with these challenges. Thank you.
Thank you. Thank you very much, Ariel. Look, we have another 10 minutes and we have a lot of questions that are actually very specific to the national level, and it may be difficult to kind of deal with these in this audience. So I think that it just reminds us also to the really very high importance of making sure that there is national consultation, that there is the opportunity to discuss solutions through social dialogue between employers, workers, and governments, because many specifics have to really be dealt with at national level. But I wanted to, to sort of pick a few questions that I think it would be useful to hear the perspective of everyone on and I'll do that sort of as maybe a kind of a final round to close. So if each of you can, just spend 1 minute or 2 minutes maximum to reflect on, and they're quite varied questions, but I think they're all very interesting. So one is a question related to what approach is recommended when borders are going to be reopened, and there's going to be an influx from, of people from the US and from Europe, where the epidemic has been really full blown. So, what the views are on that. Of course, we all know that at the same time, that's a very important part of the economies in the Caribbean, but how to deal with that. And then a question that is quite different, but I think also very important, and I'm sure all the panelists have views on that. And that is with regard to, how you have experienced and dealt with COVID-related or COVID-caused workplace conflicts. We all know that this is a time, when mental health is very important, stress is very high on all fronts, and so it is almost inevitable that conflicts arise. And just sort of your views or your experiences on how to best deal with those conflicts that emerge. I think I will sort of keep it to those two, and ask for your quick reflections on anything else that has emerged from the conversation. Please do, but if you can keep it to between 1 and 2 minutes, and then I will just do a sort of a few takeaways before we close the session. So maybe I'll start with our last speaker now, and Mr. Thomas, your views on some of the questions that were raised.
Okay. There's should be 2 questions being asked. From where I sit, COVID-19, in terms of the persons being contracted with it, would we have to be at a real low in one of the main markets that come to us in terms of North America and Europe? Would have to be something less than 10% of the population would have the contracted with the disease before we can open up the. That's why I sit. I'm not the government who's going to open up, but that's where I would probably feel sort of comfortable, and that all systems should be in place at the airport and seaport to monitor persons, and not just only by the temperature, because the first case we had, they came to our airport, the temperature was checked, and later on the person came down with COVID. So we need to have more upscale systems in place to check persons who are coming through our seaport and airports. Look at the second question though. I think what we need is counseling. Where we have such situations, counseling will have to play an important role of all of the workers to manage situations like this. That would be my response.
Thank you very much. Ms. Edwin?
What I would say in response to that, and even when the country decides to open up its borders and when we get back to normal, I think the health of workers should not be compromised in any way. And we should ensure that we protect their standard of living and we safeguard their jobs. So that should be of the prime importance. And so once that is incorporated, when the country reopens and when we go back to our everyday jobs, once these three conditions are met from a union perspective, I think that would be in keeping with what we would want to see for workers. Again, there are even more questions, even from just looking at the chat, where persons were asking, if you are operating from home, would the employer be liable if there is an accident or you're out of the office and something happened? Again, very interesting discussion, questions coming out that I'm sure taking it back to my union and ensuring that the public sector operates within what we want for our people. I think that is what is more important for us.
Thank you very much. Thank you very much, Yvonne. I will now ask Mr. Gafour your views on sort of the kind of the broader reopening of borders, but also the conflicts that might emerge in the workplace between staff and among staff, or between staff and management, and how they've been dealt with.
Okay, Claudia, thanks for the questions. Pertaining to borders, I'll be just brief. I think for airports and seaports, it is important that we, advance the screening process, not just temperature, but, whatever other screenings we can incorporate. I think that'll be very critical moving forward. It's a chicken and egg story. It's a difficult call, but I think the advancement of the screening process is what's required. As it relates to conflicts in the workplace, there has to be a balance, because there are a lot of employees who continue to be challenged with this situation. They bring to the table different issues that we are required to take into consideration. Most of the issues are really not work related. It's more personal. Luckily for us at DDL, we have a number of persons who are counselors who've been trained, and they also mentor our employees. So when they come to work with these additional baggages, we make it our duties to make sure that we indulge them, we engage them, we communicate with them, at least to give them some comfort level that they alone are not going through this, and our company that they actually work with can provide the necessary comfort and guidance in that regard. So we do this on a daily basis, and we actually, employees will come individually to us, and they will tell us what their concerns are. And we make sure that we, at the end of the day, when they leave, at least they leave with something they can hold on to and go back and implement. And I think this will continue. It will not stop until, whenever is the time that this pandemic comes to an end. And that is something as a company we are prepared to do, to work with our employees to see them through this process.
Thank you for that. Ms. Sancho, your views from the perspective of government?
I think there are a lot of international guidelines that have brought us to the point of where we are today, where we are considering opening back borders. And I think it's important to maintain communication with all the partner agencies worldwide, WHO, ILO, who are responsible for advising us on what the level of risk is and what level of risk remains, so that we will then temper our response. It's important to then stream that downstream to agencies within the country, so that when the borders do open back, we still maintain the level of vigilance and the same guidelines with regards to hand washing, social distancing, because those are the things that have brought us here now. So we have to continue to do that, so that we will continue going along the same line. With regards to the mental health. I think mental health is something that is so difficult to palpate because you can't see that, you can see physical wounds, but you can't see mental wounds. I think leadership of the organization, leadership within the country. I always say leadership is bringing people together, but also letting people know that they're not alone. And also leading on partner agencies as well, where we have people who specialize in dealing with mental health issues. I think we need to lean on them as much as possible. Apart from mental health, we have to look at social programs, social help, because a lot of mental health issues come from the fact that people are socially disabled now. So I think it's important to put all those things together so we can then get to a point of recovery.
Thank you. Thank you very much. I think this that was very useful. Ariel, I'd like to ask your views also, please.
Yes, just small comments. I think what the pandemic actually has made a bit more patent is the deficits that we have in decent work. The decent work deficits that we had before now become more evident because everyone is under some sort of strain and some sort of challenge, right? So I think it's a great opportunity to take stock of that deficits and then try to convert them in future policy changes be ready, be prepared for the next one, because that will not be the last disaster or crisis or emergency that we will face. We know that the Caribbean, this is important. The second point is coordinated actions. And we talk about, for example, opening borders. So there should be some, at least in the Caribbean at OECS and CARICOM level, there should be some sort of agreement and coordination, because a country cannot accept travelers from other countries that are not implementing similar measures that they are implementing at national level. So there should be some sort of common standard, common agreement when you exit a port, then that when you come in. So there is no disparities there and you are not bringing or taking something. The tourism sector, I think it's very important for the Caribbean and for a lot of countries. It has to be, I mean, you need to rebuild trust in tourists that you are doing the right thing with these events. I talk about a label or something that can be managed between, for example, the tourism board and the union, the employers, the hotels association, the Ministry of Labor, and set very strict procedures in these establishments so that for example, the government through the tourism board or whatever it is called, so they can actually run inspections with the Ministry of Labor and can actually like give a stamp, and this stamp can be actually put on the website of the hotels, of the tour operators, and can create more appealing for the tourist. I think the return to work guidelines or procedures of policies is now the new urgence. And everything what we discussed here in this and more questions that we will try to address offline once this is over. I think all the things need to be discussed with the workers, with the employers, with the government, and then translate all this into the return guidelines. Just to conclude with a positive note, I think so far so good. Obviously, we cannot travel now, but we are seeing that workplaces are playing the role. Workers and employees are actually behaving well. Of course, we always have people that like to not to comply what it's prescribed. But in general, I see that there is a lot of respect for OSH measures, and I think that's a good achievement from employment from the work. Thank you.
Thank you very much, Ariel, and all the panelists. We are 3 minutes over time, so I'm going to close, and I'm not going to be very long. But I want to bring us back just very quickly to, well, today we are, we are celebrating our World Day on Safety and Health, which is a very important day every year. And in fact, the centenary declaration that was adopted in June last year, which was part of the celebration of the ILO's 100th anniversary, emphasized again how important occupational safety and health is, and in fact even made a sort of an invitation to really look at how we can make occupational safety and health to be considered as one of the fundamental rights and principles. And I think with the pandemic now, we actually see how this comes really to the forefront. And the few takeaways that I have noted from what I heard all the panelists elaborate on. I think one is the preparedness. We weren't prepared, and we're very much aware of how a better preparedness will help us going forward. We are very clear that the new normal is not going to be the same as the old normal. And I think, as Ariel was saying, the return to work is something that really needs priority and attention now, and that can really help all of us to go back to our workplaces at the right time, at the right speed, at the right phase, but with all the measures that can still continue to put first and foremost the safety and health of our workers. Because, as I said in the beginning, no safety and health for our workers means that we also risk spreading the pandemic into the communities, the virus into the communities. And I think the last thing, of course, as the ILO, that is always very important for us, but we heard it very strongly here in the interactions, is everyone has a role. The three partners who are with us around the table here today, the workers, representatives, employers, and the governments have a very, very important roles. We heard them elaborated, from each of your angles, and of course to come to the right solutions, because very often difficult balances have to be struck. Social dialogue is really the best way to take this forward, and all the have some processes in place for social dialogue. And of course, we would encourage that with leadership. I think it was Ms. Sancho mentioned the importance of leadership. It is very important to, through leadership, bring social dialogue to the forefront and help to determine and articulate the right guidelines, the right solutions going forward. And the last thing, the importance of communication. I think that came out very strongly as well. Each of the players here around the table have very important roles in communication. And if we want to get the trust of the workers, of the people, also of tourists, communication is going to be extremely important. So that will have to be a very important part of our work going forward. So with that, I would like to thank the audience. Thank you very much for having stayed with us 1.5 hours, for your very thoughtful questions. And as Ariel already indicated, we've taken note of the questions. We will, we will still facilitate follow-up, and we would like to encourage national consultations on this very important topic to be there going forward. We stand ready to help and support you in those as and where needed. And as I said early on, the session has been recorded and the presentations will be shared with you. I would like to end by thanking all the panelists for the wonderful contributions. I think we learned a lot, and a lot of material was covered in the time that we had. Thank you for being with us. Thank you for your thoughts, for your experience, and for your great insights. And I wish you a wonderful rest of the day. Thank you very much.
Claudia, just right, and I would like to, I saw some questions run across the screen directly to me. They can be sent to me and be grateful. Thank you, Claudia.